implementing Medicare for All, because as we all know, it's absolutely necessary. We were facing a catastrophic healthcare crisis before COVID-19, and now that crisis has become much, much worse. And with millions of people being laid off from work and losing their employer-provided healthcare, we need to do all that we can now to fight for Medicare for All. We need to heavily reform the healthcare industry, profiting off of sick and vulnerable people. Healthcare is a human right, and everyone deserves the dignity of seeking healthcare when they need it. As Bernie said, it's a disgrace that we are the only major country on this earth that doesn't provide healthcare for its people. Tonight on this call, we'll be going over what Once Again PAC is, why it's important to continue voting for Bernie in order to fight for Medicare for All, and afterwards we'll have a panel of Medicare for All activists as well as healthcare professionals answering questions and discussing the importance of the platform. And lastly, we'll let you know how you can get involved with organizing for Bernie once again. Let's start off by giving some information about our guest speakers tonight. First, we'll have Erika Gabaldon Feresten, president of the Pacific Palisades Democratic Club, elected delegate to the California Democratic Party Assembly District 50, co-director of Healthcare for All Los Angeles chapter, a Democratic socialist, and a stressed out homeschool teacher. David Himmelstein, a primary care doctor, a distinguished professor at the City University of New York's Hunter College, and a lecturer in medicine at Harvard. He served as an advisor to Bernie Sanders, and his writings included widely cited studies of healthcare administrative costs, the moral consequences of uninsurance, and medical bankruptcy. He and Dr. Steffi Woodhandler founded Physicians for a National Health Program, whose 23,000 members advocate for nonprofit single-payer national health service. Michael Lighty has organized, advocated, and developed policy for single-payer Medicare for All nationally and in California for nearly 29 years. He is a founding member, a fellow of the Sanders Institute. Last year, Lighty retired from the California Nurses Association, National Nurses United, where he was the director of public policy. He was the lead policy analyst, leader of Healthy California, and testified on behalf of the single-payer bill, SB 562. Most recently, he was the healthcare constituency director for Bernie 2020. And lastly, Dr. Bill Honigman, is an emergency room physician, recently retired after practicing for over 35 years in Orange County, California. Dr. Bill has been active in politics since his youth and is currently an organizer for the grassroots group Progressive Democrats for America, acting as California state coordinator and Orange County chapter leader, and is a coordinator for Progressive Democrats of America's National Health Care Human Rights Issue Organizing Team. He is also a member of the Steering Committee for Physicians for a National Health Program, California chapter. Dr. Bill is a strong believer in healthcare as a human right and an advocate for single-payer, enhanced and improved Medicare for All system. So we'll start off now by discussing what Once Again PAC is. We are a political action committee organizing votes for Bernie in upcoming primary elections up until the Democratic National Convention in August. Our goal is to reach 1,200 total delegates, and that in turn will allow us to bring platforms like Medicare for All, the Green New Deal, student debt cancellation, and an end to for-profit war to head to the convention to be voted on. So now we'll talk about why you should still vote for Bernie if your state hasn't already. We have a rare opportunity right now to move forward with Bernie's progressive platform to the convention if we're able to garner at least 25% of the votes and delegates in each state, especially next Tuesday on June 2nd. Unlike the general election in November, continuing to vote for Bernie through the primary election will not mean a vote for Trump. That's only the general. We're still in the primary. If we succeed in reaching that 1,200 delegate threshold by voting for Bernie through the primary, it would mean bringing platforms like the Green New Deal, Medicare for All, student debt cancellation, and an end to for-profit wars to the convention, whether or not Bernie is the presidential nominee. What we are asking here from you is to not give the on everything we've been fighting for. If your state hasn't voted yet, understand that a vote for Bernie is one that may have an impact on the future of the party. Now is not the time to give up or become apathetic. We are just getting started in making Sanders' policies a reality. Bernie has always, always, always emphasized not me, us, and our job is to pick up where Bernie Sanders left off and carry his torch across the finish line in this election and beyond with everyone in our movement. Our movement will continue with or without him, and really all of that is dependent on us and what we do in these final weeks. I'm going to pass it over now to my co-host and fellow Once Again PAC organizer, Lighty Gopal, to explain the delegate process, introduce herself, and kick off our panel discussion tonight with our special guest. So, Lighty?
Thank you, Lynn. Hi, everyone. Again, my name is Lighty Gopal. I'm a national organizer at Once Again PAC and former member of the Bernie 2020 national organizing team. So there are still over 1,200 delegates left to be awarded in the Democratic Party. And we are aiming to pick up all we can for Bernie Sanders in the remaining months. The work on the Bernie Sanders campaign to get progressive policies into the platform is all culminating at the convention. And we want to be able to put our strongest foot forward. So it's important that we all vote for Bernie in the upcoming primary states. So if Bernie's delegate count makes it to 25%, we will be able to bring platforms like the Green New Deal, Medicare for All, student debt cancellation, and an end to wars to the convention to be voted on. In addition, our delegates will be present on key standing committees that have permanent legislative panels in both the Senate and House of Representatives. They usually consider bills and issues and recommend measures for consideration by their respective chambers and also oversee agencies, programs, activities within their jurisdictions. Delegates for Bernie are essential because they have legislative jurisdiction. Standing committees consider bills and issues and recommend measures for consideration by their respective chambers. One of the most important standing committees we want to have influence in through the platform committee. The delegates on the platform committee help determine the platforms the Democratic candidates need to support in order to run. Every 4 years, the Democratic Party puts together our party platform. And this is where we have the power as a movement to integrate our progressive platforms into the Democratic Party by continuing to vote for Bernie. So imagine if it was expected for every Democrat to include Medicare for All on every platform they ran on. We believe in Medicare for All because healthcare is a human right. What we are witnessing in this time is an unprecedented crisis affecting millions of people all over this country. Thousands of people are dying. And although we are facing a catastrophic healthcare crisis before the COVID-19 pandemic, we're definitely in the midst of the void right now while the pandemic is happening. Already 87 people are uninsured or underinsured. Layoffs have caused tens of millions of people to lose their current employer-provided healthcare coverage, which not only places a strain on employers, but also the lives of millions of families unable to receive the attention that they need. Thousands of deaths and bankruptcies have been caused by overwhelming healthcare costs, price gouging, and healthcare insurance companies filling the pockets of politicians have led us to this point. People do not seek healthcare in fear of cost because they are one missed payment away from being homeless. As the pandemic grows, we are seeing more and more reports of people who have delayed treatment due to the concerns about costs. It's not only these communities that are being affected by our healthcare system. Our U.S. hospitals are in critical condition. Even they are struggling to keep their doors open and essential health workers paid. The underlying issue here is the profitability of these hospitals. Our current healthcare system profits off the sick and vulnerable. And if fewer and fewer people are opting out of healthcare due to cost, we are going to witness a catastrophic collapse in hospitals, thousands of jobs lost, and vast communities all over the country without a hospital in sight. In this pandemic, uninsurance will only lead to even more deaths, COVID-19 transmissions, and the disintegration of our already flawed healthcare system. This should not be happening in the supposed richest country in the world. We don't know how long it will take until these lockdowns are over, but we know is that we can no longer sustain the way or be prepared for the next pandemic if we do not address the situation now. It is imperative that we continue pushing Democrats to support Medicare for All. And with that, we're going to conduct our Medicare for All discussion, in which these experts that Lynn introduced us to earlier are going to do a deep dive into very specific questions about Medicare for All and why it's so important. So I'd like to kick off the discussion with, why is Medicare for All such an important healthcare reform? And so we're doing this round robin. Anybody can just hop in and have a conversation with folks, but how about, for the sake of logistics, we can start with Erika.
Well, thank you so much. And it is quite an honor to be on this panel with these veteran single payer champions. I am relatively new to the movement, having dived in 2017, and just lots of love to Maureen Cruz, who all of these panelists know, who has been my single payer mentor. And before we get started, if you don't mind, I'd like to ask everyone to join me in taking a moment to say the names silently or out loud of those killed by police. George Floyd, Breonna Taylor, and the over 600 people who have been killed in LA County by the LAPD and LA Sheriff, and their families who continue to be victimized by a racist system that enables this violence and murder. So if we could just take a moment, I'd really appreciate that. Thank you. I think it's important to understand that the same racist justice or injustice system that allows the police to kill our Black and brown brothers and sisters with impunity is kin to our current health insurance system that disproportionately kills, maims, and causes suffering and financial ruin to those in the Black community, in the Latinx community, in the Native American community, as we are seeing now with COVID. And so to your question, why is Medicare for All so important? It is the only way to guarantee comprehensive and quality health care for every human being in the United States. And on top of that, also saves money. And so this is the way that we can accomplish that. And right now, we are facing a biological crisis, an economic crisis, a social crisis. We have an impending financial crisis. And two things should have already happened. They should have been the first things that our Congress did, which is passing Medicare for All, giving everybody health care, and a UBI, so a universal basic income. With that, I think, I don't know if I'm supposed to pick or if you do, but I see Dr. Bill, so I will pass it off to Dr. Bill, round robin.
Well, sure. Thanks, Erika. Thanks for having us all on the panel tonight, and appreciate everyone listening in, joining in for the movement. So. I would just add to that this COVID-19 crisis is accentuating the problem that we have. It's really not just a medical emergency; it's a climate emergency. And as the climate is changing, we can expect, of course, more and more of these novel infectious agents. And so this may be the first of many, and we should learn the lesson, rather immediately. Otherwise, we're all at risk. And that is that that we've got, big, in this country at least, we have big insurance and big pharma calling the shots, and they've set priorities and how we access healthcare to create really healthcare deserts, so that people in rural communities, especially, and very inner city communities, don't have access to healthcare. It's based on a public-private partnership that where the private side of the partnership is really all about profitization. Privatization means profitization in this case, and they're pulling resources out of what we could apply to handle the public threat that we're under. So we really need to control that. That's what Medicare for All does. And that's, as opposed to what we have now in this country, at least, is really wellness for the wealthy. And as we see more global warming, unfortunately, we're going to see more of these pandemics and novel viruses and other contagions are likely to show up, including already environmental toxins and disasters kind of on the horizon. So it's time that we, the people, were in charge and cut out the profiteers in the system and put we, the people, in charge. And that's why I think we're all strong advocates for Medicare for All. And who might be next? Michael?
David, go ahead.
Well, I think Bill is actually exactly right. We have a healthcare system that's really been turned into a business rather than something that is organized to care for people. And it's a business that's perfectly designed to extract profit and to benefit the wealthy, and not just poorly designed, but not designed at all to help people when they actually have need. And maybe nothing illustrates that more dramatically than what's happened in the last 8 weeks or so. We've lost 1.5 million health workers have lost their jobs in the last 8 weeks. And meanwhile, the insurance industry hasn't lost any jobs. In fact, they're making record profits and celebrating that the money flowing into insurance is going up. And we had one of the giant for-profit hospital chains, their spokesman saying, we're in financial trouble because our business model is based on providing elective surgery to patients. And when we're actually called on to do what's needed, we lose enormous amounts of money. I think nothing could be more revealing than a healthcare system that is focused on doing things that aren't needed, on elective procedures. And when things are really needed, the healthcare system begins to collapse. And we need to turn that around and stop it from being a profit machine and start it to actually being a machine that takes care of people and that's organized to deliver care. Now, we're throwing away hundreds of billions of dollars each year on useless bureaucracy and the profits of the insurance industry and the drug industry, and increasingly the hospital and the doctor industry. We have venture capital firms that are buying up doctors' practices. And one of the things that's happening at this moment is lots of small practices are failing or going bankrupt, and venture capital will swoop in and buy them up. And what that means is more of the worst pieces of our healthcare system. So Medicare for All is, frankly, the minimal reform that we need to address the vast problems in our healthcare system, to make it a public service, not a business. Michael, you haven't talked yet.
No, I don't have anything to add, man. I think you guys got it.
Thank you. That was so very powerfully said by all three of you, with Michael's also approval there for the language on why Medicare for All is so important. What came up just now significantly was the amount of money that is being wasted with our particular system now. And so I'd love to hear more about how specifically having Medicare for All would save money.
Well, I mean, there are a couple of simple ways it does it. Every time you pay an insurance premium, 15 or 16 cents of the dollar that you pay stays with the insurance company. It never goes to a hospital or doctor or nurse or even to buy drugs. So 15 cents of every dollar gets taken out for the insurance company's profits and the CEO's multi-million-dollar income. Medicare runs for 3 cents on the dollar. Canada's National Health Insurance Program runs for 2 cents on the dollar. So right off the bat, 13 cents of every premium dollar gets saved by moving from an insurance system to a Medicare for All system. But the insurance companies inflict on hospitals and doctors enormous paperwork, and that's incredibly expensive as well. Years ago, I was visiting a friend hospitalized at a leading Canadian hospital, and he was American, asked us to look into his bill. And the billing department at that giant hospital, almost 1,000 beds, was 3 people. And their job was to send bills to Americans who wander across the border and get sick. And when we got back to Boston, we went by the comparable hospital in Boston, and they had about 600 people in their billing department. Not because they were inefficient, but because hospitals have to fight with insurance companies over every Band-Aid and aspirin tablet to get paid. So by eliminating the bureaucracy of the insurance industry, we also lighten the load on doctors and hospitals. And all told, and this is an estimate we've published in the leading peer-reviewed medical journals, all told, we could save about $600 billion, billion with a B, in bureaucratic costs each year by moving to a Medicare for All system. And that's enough to give everybody in the country first dollar coverage, no co-payments, no deductibles, to upgrade long-term care, which is just a disgrace in this country. And we've seen the toll that takes with the coronavirus epidemic, with so many nursing home patients dying, and frankly, the nursing home workers dying as well. They're some of the poorest paid workers in our nation. They haven't had even the barest of personal protective equipment. Many of them live in poverty themselves, and we need to upgrade long-term care in a major way and still save money with Medicare for All. So full care for everybody and still less spent.
David, I just want to add on the protective personal equipment, because there's so much attention on that in the news. And the fact is, this for-profit industry cannot actually protect caregivers, because the equipment that they need is simply a cost center for those healthcare facilities that they don't want to have on hand. They have just-in-time production, just-in-time supply. The financing and profit model that currently exists prohibits them from keeping the amount of supplies that are needed in an emergency. And when the American Hospital Association was going to be told by Congress that they had to provide that personal protective equipment, they claimed it would put their hospitals out of business. That is an indictment of the hospitals. That's an indictment of the for-profit industry. And every healthcare worker suffers directly because of how we finance healthcare. And so if you cannot protect your workers who are doing the essential care, and you cannot provide health care to everybody, what the hell are you doing? And clearly what we're doing is we're enriching a set of shareholders, industry operatives, private equity, Wall Street, and politicians who benefit and provide them cover. That's not a healthcare system. That's an industry designed for profit that leaves essential services and essential protections on the wayside.
I love it when Lighty gets lit like that. Another thing on saving money in California, which I know Dr. Bill and Lighty will back me up on, the bill that they were championing, or we were all championing, Senate Bill 562. If that had passed in 2017, at the end of this year, our state would have saved $111 billion with a B dollars, which we could use right now. So, and here in California, it's, I think, about 73 cents of every dollar our state spends on healthcare goes to the insurance company. So that is money that everybody is paying out, but they're not getting healthcare. It's going to enrich stakeholders of the medical industrial complex. So just wanted to throw that out there.
And if I could add to what Erika just said so eloquently, is that, right now we're suffering a global depression. We are, with everybody stuck in their homes and so many industries in slow motion, how can we money and allocate those resources, those needed resources to handle the pandemic, but also for folks to thrive and have food on their table and that kind of thing. Clearly, this kind of system, as David mentioned, is it operates at an administrative cost of 2 to 3%. Probably at worst 2 to 3%, whereas the public-private so-called partnership that we have right now is operating probably with a 30 to 40% overhead. So that is clearly a way to save money. If lawmakers were really concerned with how do we respond to this pandemic in a cost-effective manner, they would move to Medicare for All today. Right now, it would save money, cost less, and take care of people.
I mean, the other thing Medicare for All lets you do is invest upstream. So one of the things that's happened in this country, frankly, under both Democratic and Republican administrations over the last 20 years, is disinvestment in prevention. So we spend about 2.5% of our health budget on prevention. Canada spends 6% of its health budget on prevention, and that's one of the reasons why Canada was able to respond to this pandemic. Our local and state health departments, who are really the front lines in fighting epidemics, have lost 50,000 workers over the last 10 years or so. The Centers for Disease Control has really been gutted and lost budget and lost the ability to respond effectively. And again, that's been made much worse under Trump, but it was started under the Democrats. So we need to reorient our healthcare system to not just provide care once people get sick, but to attend to prevention and the upstream things that we need to change. And frankly, to improve people's standard of living, which is probably even more important than hospitals in keeping people healthy. Where do we go next?
Yeah, thank you all. That was, I think the finances has been, I know in my communities has always been at the forefront of why should we do this? Is it beneficial fiscally? And that really shed a lot of light. So I'm based in the Bronx, New York, which is getting hit significantly by COVID right now. The numbers are astronomical, and it's a direct result of both environmental racism, but also the lack of medical care and access to it. And I just remember in high school being an intern and working at an emergency room and taking insurance information. And it just was overwhelmingly sad when folks would not provide it or they'd have hesitations around just getting care. You have folks coming in with things that could have definitely been prevented. And they were coming at the place in which they had diabetes and needed to get amputated and had never been treated with insulin. And that was something that I saw personally in my predominantly Black and brown communities. And it's something that's happening around the nation, especially during COVID. And the need for this is just immensely significant. And so this brings, you all have described the importance of Medicare for All, the better system in which we would have via healthcare, also fiscally. And so just wondering how do we actually advocate for Medicare for All to other to other Democrats who aren't currently supported? Like, who are the most powerful people preventing Medicare for All from becoming law?
Well, I think that there are key members of Congress that are obviously not on board. The chair of Ways and Means in the House, Richard Neal, for example, and also Frank Pallone, chair of Energy and Commerce, which is really the key committee of jurisdiction. It's also true that the task force, the healthcare task force that Senator Sanders and Vice President Biden set up on healthcare has a majority members who say they support Medicare for All, including the president of SEIU, a union, the largest healthcare workers union in the country, which has time and time again gone on record in support of Medicare for All, and a Congress member appointed by Vice President Biden, as was Mary Kay Henry, the president of SEIU. Those two folks could carry the water for Medicare for All on that task force. They are key players. They represent constituencies that support it. Unfortunately, they also represent a politician who apparently doesn't. And so the other truth, I think, is that this ultimately goes down to a power analysis. You've got key supporters of Vice President Biden, James Clyburn, for example, from South Carolina, Cedric Richmond from New Orleans, who are not in favor of Medicare for all, but whose communities are devastated by the current healthcare industry. And so it is a matter of understanding how power moves in those districts and who can move those members of Congress. And that, I think, takes a strategy and ongoing work. But really what we ultimately need to do is get the supporters of Medicare for All to actually support it and act on it. And that's going to take mass mobilization. And ultimately, it's going to take an escalation of tactics, I think, including civil disobedience, like we saw when the Affordable Care Act was threatened. When you have folks in wheelchairs, people with disabilities in the halls of Congress demanding this reform, I think we'll get it. And when we move the Democrats, I think some of those unions who have been reluctant to join in will also come along. But it's going to take a rising up from the rank and file, I think, also to move those unions.
Well, I think Michael is exactly right. It's going to take a massive mobilization of people power to get this through. I mean, we know that something like 60% of the American people support it when you ask them, but we need to not just have them passively supporting this kind of radical change, but really actively mobilize to support this and many other radical changes. You know, there's a wonderful book that Naomi Klein wrote years ago called Shock Doctrine, how the right wing has used times of calamity to implement radical movement to the right in nations around the country. And frankly, they're waiting to do that with the coronavirus as well. But we need to take this opportunity to move the debate about healthcare and many other social issues, and certainly racism as one of the top issues in this country, and intimately intertwined with healthcare, and mobilize people into the streets and into the halls of Congress. You know, for my students at City University of New York, at Hunter College, I often start the semester with a letter that Lyndon Johnson wrote to his constituents when he was a senator from Texas, saying that he was an ardent states' rights advocate and anti-integration. And then as president, of course, he implemented the boldest civil rights agenda that we've ever had in this country. And Johnson isn't the one who changed. It was the country that changed and the people who drove him to change. So we can change the politicians if we change the sea that they swim in. And that's really what our mandate has to be, is to change the country around the politicians and then mobilize that to change the politicians.
I think that we are going to have to engage in more tactics of civil disobedience, as was mentioned. I think that, in the words of Baba Akili, he says, polite don't get you shit. And I think we've been too polite. There has been a movement for single payer healthcare for over 100 years in this country, and we're still here. So when you ask the question, you know, who are the people, you know, standing in the way or blocking this? I guess I would kind of answer that by saying, I think two of the most powerful people who could immediately be heroes in this moment and move this forward would be Nancy Pelosi and our House, which we have a majority of Democrats in, and Governor Gavin Newsom. California, so I'm moving from federal to state, but a lot of times I feel that activism has more power on a local level. So, you know, 200,000 of us can march down Pennsylvania Avenue and it won't even make the news. But if 20 of us show up in our city councilman's office, they're sitting straight up and listening. And I think on the state level, California is uniquely situated to lead the country, just as it was in Canada. It was a province that led their country for their single payer system. And California is the world's 5th largest economy. And Gavin Newsom is at the top. And if he said today, put a bill on my desk, let's do this thing, it would happen. And here in California, over 80% of Democrats support single payer, and something like 6% of Republicans. We have a Democrat governor, and we have a Democrat, not just majority, but super majority. So I think the thing that's standing in our way is political corruption. And I think that there is potential for people like Newsom and Pelosi to be heroes and lead this, and they have the power to do it. I think we go right to the top.
Right on, Erika.
That was really helpful. I think, like you all were talking about, the understanding power and power dynamics is definitely a deterrent in the general populace being able to figure out how to navigate this. Like, they understand the importance of Medicare for All personally in their communities and their family units, but also for the nation. But don't necessarily know where to put their efforts. And so understanding the power dynamics of the Democratic Party and how to actually get this passed is super essential. But I think the next question would be, what should activists, what should the individual in this pandemic right now, who understands very personally, deeply personally, how important it is to pass Medicare for All, what should they be doing? Where should their energy be going in order to navigate these power dynamics and push?
Great question. So I'll jump in, if that's okay. I think that what you're seeing really is kind of three, phases to the problem. You're seeing the immediate, the short term, and the long term. So the problem with the pandemic, immediate are things like personal protective equipment for healthcare providers, and making sure that our healthcare workers are safe in the environment of taking care of people, as well as the measures that we've had across really worldwide of isolating ourselves and paying attention to the seriousness of the problem. So that's really immediate. The short term is, how do we then allocate resources to deal with the pandemic and make sure that that there aren't corrupting influences that are pulling money out of the system and changing priorities, to the advantage of individuals instead of to all of us as a whole. And then there's the long-term outlook, which is how do we make sure that we're ready for the next pandemic, because there will be more, because the climate is changing. So all of that says that we can't afford anymore to have resources taken off the top by private entities. We need to make it public prioritization, and the way we do that is with the public in charge of the purse strings, where we, the people, are in charge of allocation rather than some corporate entity. So that's what I think is kind of the overall answer to your question.
Well, I think once we're back out of our houses and back in public spaces, we're going to need mass demonstrations and civil disobedience. And I think we need to begin to prepare for that. And what that means is that all of the pieces of society that we participate in, we need to be having discussions and motivating and organizing people. So in my case, I work in universities, or 2 universities, and in hospitals. And doctors are talking about these issues all over the country. In every hospital, there's a big conference each week, usually called Grand Rounds. And one of the topics that we try and introduce to every Grand Round session in every hospital is what should be done about this crisis in the healthcare system. And bringing up Medicare for All as the answer. Nurses have their forums. People participate in their churches, in other civic organizations or synagogues or mosques. So in all of the forums that we participate in, and at this point that's mostly by Zoom or other remote ways, we have to start talking or keep talking about these issues and really begin to organize for what's going to be once things open up again. You know, one of the things we found with the Zoom conferences in hospitals is we're getting more people participating than we ever had coming to conferences in person. So a conference that in person might have 50 people, we now see 200 people. And that's an opportunity to mobilize it. We need to use those opportunities in every forum.
I would add too that we're going to have to get real about what it's going to take in terms of resources to win. Mass mobilization, that kind of constituency organizing, doctors and nurses in the front, I think is crucial. Getting more business support is very helpful. But we also, I mean, when activists fought for the Affordable Care Act, foundations provided $40 million in funding. We have never had a systematic policy development outside of our movement, led by PNHP and David and Steffi's work in particular. The foundations have done. Liberal foundations have stayed away from this, in part because the healthcare foundations are funded by monies from conversion of insurance companies from nonprofit to for-profit. You've got institutions like the Center for American Progress, corporate funded, refuses to support Medicare for All. There is also this problem of the institutional left. You've got major donors driving the agenda of Beltway-based organizations, Democratic donors. 90% of Democrats, or those people who identify as Democrats, support Medicare for All. I always ask what political party in the world wouldn't do something that 90% of its members support. Of course, that's the Democratic Party. We're going to have to send a message to those elites. One way to do it, like we did in 1991, that David and Bill may remember, is Harris Wofford won a special election in Pennsylvania for U.S. Senate, and that kicked off that reform period where we were fighting for single payer and ultimately got nothing because they decided to do Hillary Care. We need something like that to send a message to the Senate. The Senate is our huge roadblock. I, for one, think that Andrew Romanoff's primary challenge to Hickenlooper in Colorado is an opportunity to push and get elected a Medicare for All supporter in the Senate. The centrist Democrat from Arizona, Kristen Sinema, is the largest recipient of pharmaceutical money in the Senate. She's a Democrat. So these are the obstacles that are going to take resources, and the resources that are on the Democratic side have to be moved into this essential reform, particularly because the employment-based insurance system is clearly bankrupt and a failure. It didn't do a very good job anyway. And now it's clear that people can't afford their product. And yet, of course, that's a boon to the industry because no one's using it, and that therefore they're making more money. So those, I think, are also key components. We won the policy argument to a large extent. They've muddied the water with this claim about employment-based insurance, but the policy argument is still on our side, and that's not enough. That goes back to the power analysis, the mobilization, the resources, and a political signal that takes out or replaces a non-Medicare for All supporter with a real champion.
I think, you having this forum is part of it, and hearing people on this panel spell out the truth, because there's been a lot of obfuscation. I mean, like I said, here in California, our platform has single payer in it. So our platform has it. Not all of our, but many of our Democratic elected officials say they support it, but yet they don't follow up with the action, and people need to see what's happening. So I have a phrase, show me, don't tell me. I am tired of the speeches. I am tired of hearing people talk. I want to see action. And so part of this is, pulling back the curtain so that people can understand it's not good guys in hats over here and bad guys in hats over here. The whole damn system is politically corrupted with money. And we will never make enough money or generate enough money to beat them on the money front. They're just, the medical industrial complex is one of the wealthiest complexes in the world. That and the military industrial complex. So where we do need to raise money, we're still going to have to err on the side of truth and action to move this through. And I think for starters, in addition to having more things like this, people can join their local groups that are supporting efforts for single payer Medicare for All. PNHP, not just saying this because you're on this panel, oh my gosh, the work that they do is incredible. Just go on their website and start reading. You too will be on a panel because just reading their information will make you an expert. PDA is another national organization. Democrats, Socialists of America. These are all organizations that are national that people can join, start reading their material, and then they have local chapters where you can start organizing locally. Ideally, I'd love to see our union friends and allies start organizing a general strike and hold out until they give us Medicare for All and a UBI. This should have been done on the first, I call it billionaire bailout. They call it stimulus bill. And I think it's very telling that we've had 5 of these quote unquote stimulus bills passed, and not one of them had health care for the people in it. The message is loud and clear. They're not going to give that to us. And so we're going to have to take it. I can rant more if you'd like.
I was just seeing if you wanted to chime in as well.
Well, I think many of us had hoped Bernie would be able to lead us on this, and we're still very hopeful that there will be a fight at the Democratic convention, and this issue will be aired there. I guess 27 years ago or so, I met with Hillary Clinton in the White House and spent about 4 hours explaining single payer to her, and at the end of it, she said, you make convincing arguments, but is there any force on the face of the earth that's prepared to go against the insurance industry and the hundreds of millions they would spend to defeat this? And I said, how about the President of the United States actually leading the American people? And her response was, tell me something real. So we desperately need political leadership that's real political leadership. But we can help create that political leadership. And as Michael said, elevate people who really could be real leaders to be helpful in this fight.
I really think you're right, David. Presidential leadership is what's defined, particularly for Democrats, the realm of political possibility on healthcare reform. And that is, that's why it really mattered, to have a champion. And that's why it still matters to elect Bernie delegates, because we need a champion. The last thing that Vice President Biden wants at the convention, whether it's virtual or not, is a floor fight on Medicare for All. That was my experience in 2016 with the Clinton campaign. Literally, those delegates told me at the platform hearing that the fight over Medicare for All was war and that they would not compromise at all. We were told going into the Biden task force that they were not going to consider Medicare for All, even though a majority of the task force supposedly supports it. So you get a sense of how this goes when $800,000 was contributed to the Democratic Congressional Campaign Committee in the weeks prior to the HEROES Act. The HEROES Act could have expanded Medicare to cover everybody and cover their out-of-pocket expenses, but it didn't. Instead, it's another boon to the insurance industry by the paying of, if it even passes, paying of COBRA premiums only for the employed. And that's a direct result of the kind of influence that the industry has on Congress. Similarly, you had this special election in California where Katie Hill had to resign. She ran as a supporter of Medicare for All and won in that district. They, in the infinite wisdom of the California Democratic Party, put forward a candidate who doesn't support Medicare for All. Guess what happened? He lost. And And so it's not that is she lost. And that is not a coincidence. If you do not activate the base on a key issue, literally affecting their life and health, then you're not going to get the kind of energy that you need to win elections. Say what you will about President Trump, he understands how to motivate his base. And in fact, the worst elements of it, the most racist and white supremacist elements in particular. We do not do that. They do not do that on the Democratic side. And the Sanders campaign pointed the way to how that could happen. And that's the energy we've got to challenge. That's the importance of Once Again PAC and the other grassroots efforts that have to take over the mantle. It truly is not Bernie us. And that's what this political moment requires.
And, historically in other countries that have passed national health insurance or national health service, it's often happened at times of crisis. So the British National Health Service was passed in the wake of World War II when the healthcare system was really in ruins and they needed to reconstruct it. And they did the radical thing. Government took over the entire healthcare system, not just the insurance piece of it, but they own the hospitals and employ the doctors. And in many other countries, we've also seen national health insurance comes in often at a time of crisis. So this time of crisis is actually an opportunity for us. And frankly, there's no other reform that has a chance of dealing with this crisis that is spreading. Not just, we've had 30 million uninsured despite the passage of Obamacare, but we probably have 45 million uninsured today because of the job layoffs of the last 2 months. And we'll have more than that coming in, tens of millions more who won't be able to afford co-payments and deductibles so that the insurance they have is useless to them. Now is the time to mobilize on this issue because the healthcare system is falling apart. And there's an emergency that has to be dealt with.
I think it also speaks, David, I totally agree with that the pandemic can kind of substitute in a way for the kind of presidential leadership, but because it also speaks to a sense of how do we take care of each other. And the best impulses that have come forward during the pandemic are about that, about mutual aid and caregiving, a sense of solidarity. And what we lack in healthcare is so clear during the pandemic, basic peace of mind. That's what Medicare for All ultimately would offer in the face of this pandemic and in the face of the ongoing healthcare crisis. So I really feel that at the level of values of caregiving and community, we can take advantage of the most positive things coming out of this horrific pandemic and build on them to create a sense of solidarity, which you saw in the UK coming off the war, which you see in Canada, created really enhanced by the healthcare system, right? That it became more solid, the country became more solidaristic, and now it's a pillar of how they see themselves as Canadian and what they value in their country. I think the same thing could be true in the US. And if we could tap into that.
I mean, we feel it. I've been recently in Boston and New York, and at 7 o'clock, people go out onto their porches or into the streets and actually applaud and sing for the healthcare workers, not just doctors and nurses, but the orderlies and people cleaning the rooms, the whole crew who are taking care of people. And by the way, they're not applauding the CEOs. The CEO of Mount Sinai Hospital in New York at the time when his hospital had tents in the park across the street where it was housing patients because the hospital had overflowed. That CEO fled to his condo in Palm Beach. So, who actually matters are the people who do the work, not the people who are like that CEO making $6 million a year for doing useless things.
I think
Can I just chime in?
Go ahead, Dr.
Just real quick. We have one political party in this country that's wholly owned and operated by corporate America, and that's the Republican Party. There isn't a single member of the Republican Party who's on board for Medicare for All. The Democratic Party is split, but we do have champions. We have Pramila Jayapal from Washington State. We have Ro Khanna here in California. We have Bernie Sanders. So there is an avenue for the kind of activism, even within the two-party system that we have, and that's where we need to kind of emphasize at this point.
And I think also too on that point, Dr. Bill, that's why we need those progressive Democrats to really make a stand right now with Nancy Pelosi and demand, I'm sure, I know that Pramila Jayapal and others have put forth bills, but she has stopped them from getting to the floor. So we need them to do what we're asking what the people to do, to stand up and demand that this is happening. This is, we are in a crisis. And if not now, when? This is only going to get worse, as we've all said. And we don't know what our economy is going to look like. I mean, yes, we see that for the 1%, their pocketbooks have grown. But we are looking at an unstable economy, and it's a really different world when you're poor, but you have comprehensive health care and quality education, than when you're poor and now you're fighting to have these basic needs met. So I really think that people need to understand that there is an urgency, that I feel that we are at the 11th hour for this. We don't have time for task forces and all of these things. We have to have the people in power act now to help us with this biological crisis, to help us with this economic crisis, to help us with this social crisis.
Yeah, Erika, I would make something very concrete. And Congresswoman Jayapal is a powerful and extraordinary leader, and actually voted against the HEROES Act, which was heroic in a sense, because it did have some good stuff in it. We need a block of members of the Congressional Progressive Caucus who actually leverage their power as the largest caucus in Congress, much bigger than the third way caucus or the mods, and say, we're not going to vote for any healthcare reform unless you give us a vote on Medicare for All. And without those votes, they can't pass anything. They can't pass modification of the ACA. They can't do anything. That's the kind of leadership we need, is a bloc in Congress to take that kind of powerful stand. They're going to have to be motivated and supported by the grassroots and folks in the halls of Congress and in the streets and all the other things we talked about. But that is, I think, what it comes down to inside the House.
Yes, and you said it so much more beautifully than I did. And that's my huge disappointment, that on this first stimulus bill, that's where we needed to see that. They gave away their leverage because the CEOs and the 1% got everything they wanted, and they call this the CARES Act and the HEROES Act to make it sound nice. So, yes, since that's already happened and moving forward, they need to stand as a block, as you said, and say, we're not going to support anything until we get, and I'll say it again, Medicare for All and a UBI, because I think we need money in the economy now.
Yeah, I mean, so far the biggest recipient of stimulus money in healthcare is a for-profit hospital chain called Community Health Systems that's gotten more than $1 billion in federal bailout money to help the stockholders.
I would add, David, they're the most anti-union hospital chain as well, even more anti-union than HCA and Tenet, if you can believe it.
I am absolutely in awe of the amount of detail and information I just received, and everyone else has just received, on Medicare for All, and just the intricacies of the necessity of it. I think my favorite part of experiencing this panel with you all has been the immense call for humanizing just the American populace, and really fighting for Medicare for All, because it will do just that. It will treat people just the way they need to be treated and the way they deserve to be treated. And I'm just really grateful for you all. And we're hitting time, and this conversation, I feel like, can go on and on. Please take a moment and watch this again. And there have been many resources that have been named, and so there's many ways to get in this fight and continue in the movement. And so I'm going to kick it back to Lynn to close us off.
Thank you, Lakshmi, and thank you so much, everyone, on this panel. This has been extremely informative and also inspiring. You all had so much fire, and I hope more folks come across this live stream and understand just how important it is that we continue to fight for Medicare for all. So thank you so much, Erika, David, Michael, and Dr. Bill. It's been an honor to have you on this live stream tonight. So we have
before we close out, just would love to plug, if you're in Los Angeles, if you can show up tomorrow at 12 p.m. at Pan Pacific Park to support Black Lives Matter, would love that. And final thought, as Marine Cruz always says, our representatives are there to represent what we the people want, and that's Medicare for all.
Woo! Yeah. Appreciate you so much, Erika. Thank you. You have it, folks. If you're in the LA area, you have your big call to action. So I hope you show up. So we have made great strides with Medicare for All in the past couple of years, and we have to keep pushing to make it happen. If 77% of Americans on both sides of the aisle are in support of Medicare for All, particularly working class people, then isn't it time for Democrats to come together and help support this and reconsider? It is imperative for us to continue getting out the vote for Bernie in these upcoming states to keep fighting for Medicare for all, because the health and well-being of our entire country is dependent on it. And if you want to join the efforts in helping us make this happen within these short few weeks, please sign up at onceagainpac.com/volunteer, and we'll continue the fight and bring Medicare for all to the convention. We hope this has been thoroughly informative for everyone streaming in, and for everyone tuning in tonight. Join us on our next panel discussion going over an end to for-profit war on Sunday, May 31st at 8 p.m. Eastern. Thank you so much, everyone. And remember, not me, us. Have a great night.
Good night.
Good night.
Thank you.